My brother called me one evening to tell me that he'd got a very high PSA level.
Let's be blunt about it, it's a killer disease. It kills more men than breast cancer kills women.
So I found out I had prostate cancer a couple of months after my 60th birthday. I went down to see my GP and had a PSA test, which is a test which they do when they take a sample of your blood. And the only reason I did that was because I had a business colleague who had prostate cancer and said to me that a man of my age should go down and have a PSA test and know my numbers. So I did that, and I had a slightly enlarged PSA reading of 4.6, and I was told that 2.8 was about right for a man of my age. The GP suggested I see a consultant, which I did at the Royal Surrey, and he did a DRE on me, which is a digital rectal examination, which takes about 20 seconds. And from that he could detect I had a slightly enlarged prostate. The problem with the DRE is they can only feel part of the prostate. So he suggested I had an MRI scan, but in his words, it was unlikely to be anything. And so I went along and had an MRI scan, and then came back to see the consultant. And it was only at that point where it was rather shocking that I learnt I had prostate cancer.
I'm a survivor. I'm a very, very fortunate survivor. Because if my brother had not called me that evening, I would not have had the test. If I hadn't got an appointment with the GP, I probably wouldn't have mentioned it to him. And I've had 15 fabulous years, seen the family grow and develop and grandchildren being born. Had some excellent time with the family, with my wife, holidays and so on. So I am just so very, very grateful.
So what I want to say for all men over 50 is know your numbers. Go and get tested. It's not a big deal. And if you catch prostate cancer early, you can be cured. They'll take away the prostate or they'll give you another intervention. But if you let it go on and you find out too late and the cancer gets outside the prostate, then it can be a real problem. Because if it gets to high-grade cancer, it can go to your bones and it can be fatal.
I see on a regular basis men in their 40s and 50s presenting for the first time with a PSA in excess of 15 or 20, and the question that they always ask is, could it have been picked up earlier? 80% of men with prostate cancer have an elevated PSA. So please don't be that man who presents with prostate cancer which is too late for the best possible outcome. Know your numbers, get your PSA checked. If you're between the ages of 45 and 70, have your PSA checked.
I discovered I got prostate cancer entirely by accident. I wasn't specifically requesting a check. I was going through blood tests for another particular health check I was going through, and the nurse said to me as we were going through the blood tests, I assume you want your PSA tested. I had it checked. About a couple of weeks later, the numbers came back, and my numbers were higher than they should be. And that began a whole process of additional checking, which resulted in the fact that, at the end, I had to come to the conclusion that I had prostate cancer and had to do something about it. But I was lucky.